when you started, so first of all, you should ask the first question is about what's the candidate classification for this case 2? Yeah. Class 2, modification 1. Remember last week I told you, because I assumed all the tools is solid, is health, and you're going to restore all the dangerous area. That's why this one will be the class 2 modification 1. The first question is about what's the kind of classification, followed by the scenario you will be given. Then you check the case principle manual to find out how many abutment you need. In the future, you might have your opinion, but so far, before you really have your philosophy of treatment, I want you to follow that manual. When you have more experience, maybe you will question about the design. I pretty understand that. But before you have those abilities, just follow that. Because if you follow that, you have a reference. So in the KISS principle, when you go to the classification, class 2 with modification, they tell you to choose 3 direct abutment. So you should have 3 direct abutment. And also this is the one distal retention area, so you would know the femur will have a rotation. So you should have indirect retainer. And on the KISS principle manual tell you that indirect retainer will be the one of your direct retainer's rest area. So this manual give you some hint to say how many abutment tools you should have. So when you look, and if you still haven't have idea, look at the pictures we provide to you. So in your case, there'll be 18, 21, 28. How do we determine the indirect retainer location? We found 2 most posterior about the rest seat area. So there'll be one here, the other will be here. So you mark your focal line. And then you put one straight line in the front. And in your cases, they'll be falling between the canine or the premolar. So some of you maybe put a rest seat on the canine, that's still walkable. That still can be your indirect retainer. But if you don't, if you just put a rest seat on the premolar, on 21, that was still okay. And remember, we don't want to put a rest seat on central and lateral incisor. That's a list. Ideal abutment for indirect retainer location. So after that, you started to do what we call diagnostic surveying. Means that you already have some idea, and you try to find out if you can find the undercut. So you can design the class locations. So before you do that, you should know what's the class design you can have, and where is the undercut location. You already know from the KISS principle manual, you know you need to have 3 direct retainers. And they also provide you some idea about the class. If you really follow that in the first beginning, it looks like you want to have a circumferential class on 18, roll wide class on 21, I-bar on 28, followed by the picture you'll be provided. Then you do your diagnostic surveying. You put the cast on the surveyor to try to find out if you can tilt the case properly, so you can find the undercut on those 3 locations, all on the same time. And when you do surveying, actually when you adjust anterior posterior, you will affect your guiding plan's location. Ideally, they should be parallel to each of the tools, have a guide plan. Remember, we should have a guide plan on the tools next to the dangerous area. So they'll be on 18th mesial, 21st distal, and 28th mesial. And also when you tilt the cast mesial distally, then you will change your undercut location. When you try to do a diagnostic surveying, when you do a surveying, don't over tilt your cast. You shouldn't be over 15 to 20. On the evaluations sheet, when you do your competency, it give you more freedom. You can up to 30. But actually that is already very awkward in a real situation. When you tilt more, it means that your patient needs to see the framework in a very awkward angle to the tubes. It's not workable. So ideally still not over 15 to 20. So that's a tricky case you first beginning to have. When you found you want to use a case principle manual, you want to find the undercut on those three keys, you found you are not able to find anyone. Because this molar, the number 18, is lingual tilted. And we know we need to have an I bar on 28. So you will find out that actually the 18 will be the major issue. However, when you have those, then you will need to do some modification. That's why the KISS principle manual just give you the rough idea in the first beginning, but some that were not able to fall into all the cases you will be encountered with. So you still need to know the concept. That's why you still need to learn from the lecture. However, when you do the survey, you find out, okay, because this one is lingual tilt, so I couldn't have a buccal undercut. However, it seems like I can find undercut on the lingual. I can find undercut on the mesolingual, distal lingual. So, what can I do? So how do you modify it? So if you use the mesolingual undercut, then you have to change your class design. When you check your KISS principle, you will have 4 different classes. You can choose. And when you have a mesolingual undercut, this one will be used the ring class. When you have this, the other 2 still can follow the original ideal goal. What's a ring class looks like? The ring class is like this. If you do if your case is a lower cast, then you definitely draw this one before. So when you look at a ring class, what this tell you? This is a solution for lingual tilting mandibular molars. So it's not always like just the I bar or the circumferential. You have an embrasure class, you have a ring class. Depends on where is undercut. So you should know how to modify that. Those class description is on the back of the KISS principle manual. When you look at this case, actually you can have multiple design. They probably still fall into the reasonable criteria. If we use the mesolingual, that will be a ring class. However, if you think, okay, so it looks like I don't know the ring class, I still just like the circumferential class. And I can find the distal lingual. So maybe I can move my retentive clasp from the buccal to the lingual. Just reverse it. That will still workable. However, this is not ideal design because think about that. When patients try to remove the removable partial denture out of the mouth, that should grab the retentive arm and dislodge it. If you put a clasp, have undercut on the most posterior teeth and also on the lingual side, means that your patients need to put their fingers more back to the mouth, close to the throat, and to dislodge it. That's very awkward. But this design still fulfill the criteria or the retention part. But for patient's comfort, that's not an ideal design. That's why I said in the first part, if you draw the first one, that will be the ideal. If you draw this one, it's probably not the ideal one. Also, I haven't talked to you before. I said I will explain that today. So you can also do some modifications on the tools. You can add the composite to change the contour of the tools, or you can make a survey crown to change your tools. However, remember the KISS principle means that we want to keep it as simple as possible. So if you need to do extra work, that's not ideal. The ideal is that you don't really necessary to change your tools or to modify the tools if you really have a chance to do that. If you couldn't, you still can do the modification. But when you do a modification, that should be fall into the principle of the RPD design. So in this alternative option 2, they will have a second. So you might think to just to get the undercut ideally followed by the KISS principle manual on the left side. And you will find out the 28 will be too lingual tilt. So what you can do is to modify the tool's contour. After those, you will have your idea how you can design your cast, and you will start to drawing the design. So remember, you should verify the classification. You should know how many tools as abutment. And the third question is about how you can design a clasp. If you need to modify it, how you modify that. After that, it'll come into the design drawing. Before you start drawing, I want you to think about what's the major connectors design for the case. On the lower, you just only have 2 options. When you have mouse forward, the distance from the mouse forward to the lower anterior piece, visual margins, over 7 to 8 millimeters. Ideally is to put the lingual bar. If you don't, then you put a plate. Why we say the ideal is the lingual bar is the first choice compared to the lingual plate. Because once you cover the tools, when patient chewing the food, you will still have the food debris or the plug accumulate around the visual margins. And because the plate is covered, so the tongue will not have able to self-cleaning. So it will cause most like a problem in the future. So ideally we want, if you can design a lingual bar, design a lingual bar. So in your cases, you definitely were over like 9 to 10 millimeters. So you know you can design a lingual bar there. And because I told you each tooth is solid, so you design a lingual bar. However, if I give you a different scenario, if I told you, in your cases, all anterior teeth is periodontal involved, have some mobility, but we will still use that as abutment or as teeth remaining in the mouth. How do you change your major connector? Then you have to change to the lingual plate, even you have more than 7 to 8 millimeters. First, be used when you don't have enough space. The second scenario is that when you have a periodontal compromised tooth, then you are likely to choose the lingual plate rather than the lingual bar, even you have more than 7 to 8 millimeters distance. So remember, you have to check, be careful, read the scenario be given. Now I will show you the option 2. So before you start it, I would suggest you to have a list out all the components you're going to go. So you should know what's your major connector, what's your direct retainer, where is the indirect retainer. When you put the direct retainer, where is your rest C, where is your guide proximal plate, where is your clasp, where is the undercut. When you have those lists, you'll have more idea when you draw. Okay? So that will be my suggestion. It's not really necessary, but that will helpful when you start it. So first you should find out the undercut locations. And then you will need to do a tripod. when you do a tripod, there will be one in the front, two on the back. They will be on the vertical wall. They shouldn't be on the horizontal part. They don't always explain about the evaluation sheet. You will see if you put on the horizontal part, you will get point deducted. And then you draw your rest in red. So you should know where is the rest. Then you started to draw the minor connector and proximal plate, as I described before. Then you will draw your buckle border of the mesh. Well, on the design sequence manual, it tells you how you can draw that. So on the left side is a tooth span. So they tell you you should draw a line about 2 mm buckled to the crest of a ridge. That's why you should have image where it's a crest of a ridge and really use a ruler or the probe to measure 2 mm away from it. So you can mark this one. And on the right side is a distal extension. So on the buckle part, still will be 2 mm buckled to the crest of the ridge. And this one tell you should extend it half to 2/3 of the total distal extensions area. If you are able to see the ascending ramus, then you should stop your femur before the ascending ramus. But in this case, you are not able to see that. That's why you use this way. Then the next step is to draw a window. So here on the design drawing manual, it tells you maxilla 6 mm away from the facial margin for each tooth. Mandible is 3. So you see, I really measure that. I actually give a little bit more. I probably give like 4 mm. But the 3 or 6 is the minimum. You can be over, you couldn't be less. And also between those two minor connectors, their distance is 5. So you see, I really have a 5 there. So that will be the window drawing. Then the next one will be the finish line. So you see here, you have two options. Depends on where's the edentulous area. If the edentulous area is on the tooth span, it's at the square U shape. So you see, you do 2 vertical next to the tooth. And then you have a lingual extension about 1 to 2 mm lingual to the lingual surface of the 16 tooth. So you connect the lingual surface of the tooth, and then you have 2 mm here. So that's how you draw this U-shaped form. So see, if you follow the design sequence, they actually tell you how to draw it. On the distal retention area, have a maxilla and mandible part. This is a mandible. So you just need to see the mandible. The mandible said, make a straight perpendicular line distal to the RPI abutment. So that will be the straight line here. Remember, they should be straight, perpendicular line. I saw some of you draw a finish line like this. They were not ideal because when you, I mentioned that in the class, but I want to mention that again. Why we need a finish line? Because we need, when we do our major connector, we want our major connector really touch the tissue so they can provide the stability, rigidity. However, on the edentulous area, those femur should fold over the ridge. Why those femur should folding over a ridge? Because we want eventually they can be embedded between the denture-based material. Why we need those? When we lose the tooth, the bone will keep continually resorpted forever. So you might need to do a reline for a couple of years later. However, we are not able to rely the material on the metal surface. We're just able to do a reline on the denture-based material area. That's why we want this part. Eventually, when we finish, the denture base touch the tissue, not the femur touch the tissue. You just only have this tiny tissue stop touch over a ridge. So when the lab do their work, they put a spacer here. They have to be sure your edentulous area, most of the femur is falling over a ridge. So you have to then know when they started. That's why you mark the finish line. So they know they should put a spacer in this area. They know they should put a spacer all around here. That's why we have this finish line drawing. They also answer the question why we couldn't do an oblique here. Because when we have a finish line, actually that's a border between the denture-based material to the femur. There's a connection between. If you make this one oblique, when the force comes down, this will be a weakened point. And then your denture-based material will be easier to fracture on this part. So this one should be perpendicular to it. That's why we say the straight perpendicular line. So you will increase the strength of your denture-based material. Then you will need to draw the inferior border of a major connector. And on this one, I assume that the anterior teeth have a periodontal issue. So I designed a lingual plate here. So you should have 1 millimeter away from the free drum margins here. And how you connect it on the top. So you have to check where is the contact point. When you see the contact point, you make a scallop shape to connect it. So the highest part is the contact point. You shouldn't be over the contact point. If you're over that, it means that your femur will be seen when patients smile. That's not aesthetically. And when you have a finish line here, when you have an inferior border here, you are still mixing one part here to connect it all together. So you should have this one connected to here. After that, you close the space. And here I mark 2 like a start. So if you're doing mesh, if you draw like the right side or like left side, then either one is okay. Then you draw your clasp. And remember, when you draw your clasp, coming from the top to the bottom, and really be sure the end of your clasp should be on the undercut location. Means that your clasp really engage into the undercut. This one actually I put a ring clasp from the lingual to the buccal. So you can see the ring clasp actually can be this way or the other way. So when you have a ring clasp design, when you know how to use that, and when you know the circumferential, actually no matter where it's undercut, you might able to use a clasp on all the tooths. Because you can see on the mesolingual, on all the area you can design the clasp. And when you do an eyebar drawing, remember you should have 2 to 3 millimeters. Here. 2 to 3 millimeters below the free drum margins. So you see I measure from here. I put 3, but ideally it's 2 to 3. And when you do an eyebar, just remember this stop will be between 2 teeth. You should image that. I saw some of you draw a little bit too further. That will be not ideal. It will be just between 2 teeth there. When we end of this. Also, you should have 1 millimeter for the width of the eyebar. Then you draw your survey line. In the end, you should have all the survey line on the abutment tubes. And when you do your survey line, here to tell you, if you need to do the modification, you have 2 ways. One is that you need to decrease the tubes. means that you will need to do enamel plastic, which you practiced in the synlab before. So you should mark 2 vertical lines. Sometimes, if you don't have undercut, you want to change your tooth morphology, then you can add the composite over the tooth. If you want to add a composite, then you have to use the blue circle. That's the 2 new things I mentioned today. In the past, I haven't mentioned that because for most of the I-bar locations, it's not really necessary to modify the tooth. However, when you design a circumferential clasp or a ring clasp, then you might need it. So, the ideal survey line for the retentive arm, remember you just divide it into third. The terminal third should be below the survey line, means that they engage into the undercut. But the first 2/3 should be above. If your survey line not really follow this, then you should do the modification. That means that you should do enamelplasty or the composite addition to change that. And when we talk about the reciprocal arm, we said this one shouldn't be engaged into undercut. So they should be always above the survey line. Remember, undercut is under the survey line. Above the survey line, it doesn't have undercut. So in this case, when I draw this, when I draw my finish line, when I draw my survey line, I find out, because this is a ring clasp, so first part is my reciprocal arm here. So my reciprocal arm should be always above the survey line. However, this one, the survey line is higher than my reciprocal arm. So I should mark 2 red straight line here to say, oh, I noticed that. I know I need to do enamelplasty here. So that's here. When I look on the lingual, when I look on the distal part, the survey line is lower than that, so I know I'm fine. I don't need to do any adjustment. When I look on the buccal, I think it's okay, because if I divide it into 2/3, just only the terminal third under the survey line, the other 2 is above, so I'm okay. So I just need to do 2 vertical lines here on the lingual. If I draw like this, that's why in the KISS principle, in the design manual, say you should draw the class design first, and then draw the survey line later, because the class should be in the ideal position. The tooth morphology should be modified to accommodate that. If you draw the survey line first, it definitely will compensate your class drawing. Then that will make your class is not workable. And here, when I see this, I can see my survey line on the tooth number 21 is very close to my clasp. My clasp is still above, but it's too close. So ideally, I still want to do some modification. That's why I still mark 2 lines here. Remember, divide it into third. Terminal third under the survey line. The other 2 should be above. And this is the alternative options. So actually, I don't have undercut here. I don't have undercut on the canine, on the premolar, on the 28th area. So how do? I should add a composite. So you see, I add this one, have a composite. I draw my I-bar here. I draw a survey line. You see a survey line is close to the free draw margin because I couldn't get undercut here. That's why I will add the composite here. It should be drawn into the blue pencil. So you see 2 different modifications. If you need to do enamelplasty, if you need to lower the survey line, there will be 2 straight red lines. If you need to add a composite, there will be the blue circle. Okay? If you mix the color, you will still get it deducted. However, when we say the KISS principle, we want to be as simple as possible. So if you draw this one, you will still get some deducted because you add extra component. Your principle is right, but compared to the ideal one doesn't really need to add a composite. But you add a composite here, so you will still get a slightly deducted from the grading sheets. So ideally, you still want to find one passive insertion that you don't need to do a lot of adjustment. That's why you need to spend a lot of time to find out the passive placement. So first, you see here, if you draw the class, if you draw any component or the windows without acceptable width, height, clearance, you'll get 2 points deducted per component. Means that if you draw 2 components wrong, you'll get 4 points deducted. And what's a component? Means so the component maybe is a major connectors width, maybe your clasp width, maybe your RPD size, or when you put the clasp, if you make it too short, then you will get deducted. So it means that if you just draw a clasp, stop right in the middle for your circumferential, that will be considered too short. It should be engaged over the tooth. So you will get deducted. And if you draw the clasp less than 1 millimeter, you will get deducted. If your lingual plate or lingual bar doesn't really fall into our requirement width, you will get deducted. And the windows 3, 5. If you don't, you also get deducted. That's why you have to be familiar with all the drawing, all the requirements, dimensions, everything. Then will be the 5 point deducted. So here, first is about acceptable major connector, but not the first choice. Like in today's case, ideal is to do a lingual bar. But if you put a lingual plate, it's still workable. But that's not ideal because you don't necessarily need to put the plate there because I don't give you a scenario to say those tools is periodontal involvement tools. So you should put a lingual bar. If you put a lingual plate, then you will get deducted from here. Some of you put a tripod on the horizontal surface. That was not acceptable. So you should put on the vertical wall. If you put a tripod here, that's not acceptable. And remember, that's a per. If you mark 3 tripod all on the horizontal, you'll get 15 point deducted.
Excuse me, what is the horse? Can you show what horizontal?
That's a vertical, right? This is a horizontal part. You see my tripod marked here. Because the tripod needs to get a plan. How can you make a plan on the horizontal surface? Yeah. So you should put on the vertical part. And here said unnecessary component added or the tools modification. So for example, in today's case, ideal cast doesn't really necessarily need to have a modification. However, if you follow my option 2, you put the composite added on the tools number 28. It will be considered as a necessary component added here. If you mark the color wrong, you'll get per deducted 5 points. So remember, only the rest, finish line, tripod, undercut, and the modifications with use the red pencil. The other framework all will be blue. And your survey line, because you use a graph to mark, so that should be black. That makes sense. You have a survey line in different color because you don't have those pencils. They should be just in black because you just have a graph. So those should be followed. So if you put different colors, then you will get deducted. And here is say per incorrect placement of a component. For example, I bar should be in the middle or the medial buckle. If you put the distal buckle, that's improper because you will make your I bar too short. They'll be too rigid. You should have some length for your class, have some flexibility, so they will be able to engage into the tubes. For example, if you mark your clasp stop right on the distal or the middle, they still be considered too short. And if you put your reciprocal arm not in the middle of the tubes, it's also be incorrect placement because we want the reciprocal arm in the middle of the tubes. The reason is we want when the clasp really touch the tubes, the reciprocal arm is already there to stop the tubes tilting. If we put too high, they are not able to help the tubes tilting. If you put too low, you're easier to involve into the survey line or undercut locations. So that's not proper. So you should be just in the middle of the tubes. If you forgot to mark the undercut with the red line, you also get deducted. Sometimes you draw the clasp, but we don't see your undercut locations. So we are not able to verify where is the undercut. So when you finish the clasp, you should see in the end of the class you should have an undercut marker. Actually, you should mark the undercut before you start the drawing. The last one is about permitting survey line on direct abutment tools. So abutment tools means that you have a clasp. So this on today's case, there'll be this one, 18, 21, 28. You should have a survey line. If I don't see a survey line, then you will get deducted from here. Remember, that's a per T's. So if 3 T's doesn't have a survey line, there'll be 15 points. So here, for 10 points to 15 points, that will be the major error. You don't want to get one of those because they are so easier that you'll fail your competency. So first, when you're mixing the component when indicated, what it means? When we say we want an I-bar, that's an RPI system. So you should have a rest. You should have a distal proximal plate. You should have an I-bar. If you forgot to put a proximal plate, or if you forgot to put the rest, you just put an I-bar, they'll be considered the missing component when indicated. Also, remember I said, all the tools next to the dentures area should have a proximal plate, have a guiding plane. If you mix that, there will also be this one. And sometimes when you have a clasp Remember, you should have a reciprocal arm. If you forgot to put a reciprocal arm, just put one side have a clasp. That missing reciprocal arm will be considered as a missing component when indicated. The second is about the folding component. Means that those component is not really connected to the major connector, the framework. So when you finish, you should see all your blue marker. They all connected together. Sometimes you put a red C here, but you forgot to put the indirect retainer, so they don't really connect to the framework. So most of the time it's talk about when you're missing the minor connectors part. So when you finish, you should see all the blue part should be closed into a closed space. Means that you really connect all together. The third is talk about when you mark undercut, it's not really match your proposed tripod. So what we're gonna do, when you draw design, when we evaluate, we will put on a surveyor. We will use your tripod to tilt this on the survey table. And then we will check your undercut location. For example, we know you should have 0.02 undercut here. You should have 0.01 undercut followed by the undercut marking. However, when we do a tripod, when we follow your tripod, but we're not able to really see undercut there, that would be considered the mark undercut doesn't match the proposed tripod. And here, the last one is about the missing requirement tools modification. So like I said, if you see your survey line is not ideal, then you should mark the red line. If you need to add, then you have to use a blue pencil to mark it. If you don't mark this and you don't have undercut locations here, means that you don't have undercut. And if you don't modify the tools, means that this design is not workable. So that's a major error. So that's why we have 10 points deducted here. And when you have here, that's a 15 point deducted. That will be about if you tilt too much. So when you put on the surveyor table, we're not talking about the surveyor table's tilt. We're talking about the occlusal plane parallelism to the floor. So if you tilt, so like this one, if this one is parallel to the floor, that will be okay. You can have some tilt, but if you tilt too much, like this way, definitely not okay. If you tilt buccally or lingually too much, that will not be okay. So when you start it, you should put this one on the table and look at the occlusal plane, the relationship to the floor. If you tilt too much, you better to find the other tilting. Otherwise, if you over 30, you will get 15 points deducted. However, let me tell. So like I said before, this one should just, if you really want your patient to work well with your framework design, this one shouldn't be over 15 to 20. Okay. So we already give you more like freedom to tilt the tubes, tilt the cast. So when you need to retake, if you fall into this part, even if you do all the things right, you will right away get a retake. First is mixing direct retainer class assembling as proposed on the KISS principal document. Like here, this case, you'll be told to have 3 abutment tools. you should have 3 abutment tools. If you're just mixing one, you need to retake. Because they tell me you're still not able to fully use the KISS principle manual, which you have to. If you do appropriate class selections, for example, when we do a distal retentions on the tools, this one just can be an I bar, or remember you can have a roll wire clasp. However, if you put the casting circumferential clasp on here, you forgot to write the roll wire clasp, then you'll be considered you put the wrong clasp on this one. You just only can have I bar or roll wire clasp on the abutment next to a distal retentions area. Some of you asked me, could we do an I bar on this case, on the case 2 here, on the 2 spawn area? You can do that. That's not ideal, but you can do that. On the 2 spawn, actually you can design any class you want. But it doesn't, but why we need a roll wire clasp? Because when we do a roll wire clasp or casting circumferential clasp, they will provide us more retentions. So they will give patients more like a retentive force on the tools. So they'll be more comfortable. We don't like to put that on the distal abutment. The reason is the same, because we don't want too much force on this one, because this one will tilt. But on the 2 spawn area, we don't have a tilting of the tubes. That's why you can design almost, I would say, all the clasps, if you can find a proper undercut location. If you forgot to do a tripod, you will retake it. The last one is that your tripod is not unable to produce identified tilt. Sometimes it happens is that you don't lock your survey arm when you do a tripod. Remember, when we do a tripod, they should be on the same height. You put on the table, and those enlightening rods should be on the same height, just moving one to front, 2 in the back. You might tilt it sometimes, or you might, this enlightening rod is changed. When you mark that, that will cause a problem when we are unable to provide identified tilt. So you will get the retake here.